أوكي. سؤال آخر يا دكتور، لو أنت مثلا في المستشفى أو مثلا لو عندك خبر حول هذا الموضوع، يعني وفي مرضى كثير لفيروس كورونا والأعداد كبيرة ودبات الأكسجين قليلة جدا، لمن الأولوية الذي يقدر أن الحصول أو يستطيع الحصول على الأكسجين؟ يعني المرضى كثير، الأكسجين قليل، لمن الأطباء يعطوا الأولوية؟
So the next question he had was about oxygen. So in the hospital, if you have many patients that have COVID and are in need of oxygen support, how do you decide who gets oxygen first when supplies are limited?
Right. So we off these initially there was a push to whoever was getting worse to put them on the ventilator, and we thought that we were going to have severe ventilator shortages. Now that we've changed our strategy on that a little bit, we don't put somebody on the ventilator unless we really need to. So this is not a situation, as far as the ventilators go, that arises too often now. It may in the future, it may not, but for so far, it's not something that arises. But how we stratify who gets to go on the ventilator or not, if there is a situation where we have to pick and choose, what happens is we just look at the person's comorbidities and their general overall health. Now, if you have a 60-year-old guy that's in generally healthy shape, doesn't have too many comorbidities, and you have to pick. You would pick that person over like a 90, 80-year-old that has diabetes, hypertension, hyperlipidemia, had a stroke in the past, is generally doing so badly that even if we were to put them on the ventilator, their chance of surviving this is like several percent, single digits. So at that point, if you have to pick and choose, you always we try to pick and choose the people that we think are actually going to have a better chance of survival. We do run into that because Mayo Clinic is an ECMO center where we do ECMO machines, which are a bit more advanced than a ventilator. And so we only run about 5 of those machines at a time. And so oftentimes that's something that we do have to pick and choose. Somebody that's we think has a higher chance of survival, we're going to give them the machine. And we think somebody that doesn't have a good chance of survival, then unfortunately that we have to deny those requests. And then if people are already on the ventilator and there aren't any more to go around, obviously we're not going to remove ventilatory support from a patient that's already on it, even though they may have a lower chance of survival than the next person. So there's also that ethical dilemma that plays into it. Well, you have the next person that has a better chance, and this person that's already on the ventilator that may be dying, you're not going to remove the support from this person to give it to the healthier person.
اوكي، قال يعني في البدايه اذا واحد وصل للمستشفى وفي الكوفيد وشافوا انه مريض يعني قوي، يدوا له فنتليتر على طول علشان كانوا يتهمون يقع بالشباب. لكن الحين تغيروا اللي هي الرئه الحين تغيروا. الحين مش اي واحد الا بعضهم الذي قدوا له هذا الدرجه يدوا له، يعني معناته الحين ما فيش مشكله، يعني موجودات كفايه علشان بعضهم ما يحتاجوش.
يعني هم كانوا من اول يخطوا يمكن من ما وصلوا له
يعني قالوا ينتبهوا عليه، يعني مش انه يضره لكن زيدوا، يعني ما كانش ضروري. لكن احسن من بدون، لكن ما كانش ضروري. الحين قالوا يعني بدل ما يعملوها يقيسوا اذا واحد يعني قد تعبان زياده يطلع له، واذا وصلوا لهذه الدرجه وما فيش معهم كفايه يشوفوا على مثلا واحد اذا على العمر كيف صحته. مثلا واحد اذا هو شباب ولا مثلا حتى 50 60 سنه وصحته تمام، يعني يدوا له فنتليتر. واذا بواحد يعني كبير في العمر يعني 70 80 سنه وبمرض كثير يعني سكري ولا بالقلب ولا اي شيء، زي ما يقولوا ما فيش فايده.
هم يعطوه يفكروا له اذا معاه فرصه من الحياه،
يعطوا معاه فرصه وجسمه تقدر تتحمل. عشان بعض واحد جسمه ما تتحملش، يعني يحصل فنتليتر ما يطلع منها شيء. يعني غادي يشوفوا على العمر واللي معه فرصه والصحه، وقال يعني ما يبقى عن ضروري، يعني ما فيش مشكله.
يعني حصل زمان
اول ما شرحوا علشان كانوا اول ما يشوفوا واحد يقولوا نجهز اذا مرض نجهز له هذا.
تمام.
لكن الحين ما نجهزوش الا اذا قدوا يعني
ضروري.
ولكن قال معهم مشين ثاني اسمها اكمو، هذا معهم منهم 5 في المستشفى. هو هذا نفس الخبر، يعني يشوفوا على العمر
الأكمو هذا الشيء أكسجين نفس الكلام؟
Can you describe in your words ECMO?
Sure. So what ECMO stands for is extracorporeal membrane oxygenation, which means oxygenating like a membrane that's outside of the body that can oxygenate blood. So in an ECMO machine, essentially, it's kind of like almost like when people get bypass surgery and you have to stop the heart, and then you have an extra, like a machine that circulates blood and oxygenates blood and returns it to you. So in an ECMO machine, you can essentially bypass somebody's heart and their lungs, whereas a machine can handle the pumping. Depending on how weak somebody's heart is, really, it's just an artificial lung, essentially. You take the blood from the right side of somebody's heart that would normally go to the lungs, and you put it into this machine. The machine basically has oxygen gas diffusion, and you diffuse oxygen into the blood, and it reoxygenates the blood, and then it returns it to the left side of the heart where it can be pumped out to the rest of the body.
يعني على ما قال إن هي تأخذ الدم وتعمل لها الأكسجين خارج الجسم، يعني بدون ما تستخدم الرئة. يعني هذا يعني
هذا حاجة جديد.
مش جديد، لكن ما يستعملهاش كثير. هذا مثلا إذا واحد عنده عملية في القلب يستعملوها. ولا زي الحين الرئة، يعني إذا الرئة يعني زيادة ضررين ما ينفع يمشي الأكسجين، يعني ضروري يطرحوها للدم طوالي مش وهذا معهم انهم 5 في المستشفى، وهي نفس المشكله. يعني اذا واحد يعني 2 3 بحاجتها وما مش معهم كفايه يفعلوا هكذا، يشوفوا على العمر والصحي وهذا الشيء. لكن قال مثلا اذا واحد غضوبه ما يطلعوش منه علشان يجوا له ثاني، هو غضوبه يسمع.
اوكي. يعني